These are the changes in nicotinic acetylcholine receptors in states of decreased neuromuscular junction stimulation. First, let's cover the normal structure and function of nicotinic acetylcholine receptors. They are ligand-gated channels that are activated by acetylcholine, and the mature receptor has 5 subunits listed here. They're arranged in a rosette around the central channel. The alpha subunit contains the binding sites for acetylcholine and neuromuscular blocking agents, and you have some changes when you have decreased neuromuscular junction stimulation for an extended period of time. When you have decreased stimulation, you have an upregulation of immature or fetal nicotinic acetylcholine receptors. This is just standard homeostasis, standard body regulation. They're not being stimulated enough, so the body thinks that they should be stimulated more, so they upregulate the available receptors to hopefully catch any possible acetylcholine that might be in the synapse. These immature receptors extend beyond the neuromuscular junction into adjacent muscle membrane. These are called extrajunctional receptors at this point. One key difference between the fetal or immature receptors from the mature receptors is that their gamma subunit replaces the epsilon subunit in the immature form. So they normally have one epsilon subunit, but in the fetal form, they replace that epsilon subunit with the gamma subunit. This has some potential causes, what might cause decreased neuromuscular junction stimulation, and those causes are listed here. Upper or lower motor denervation, immobilization, severe burns, prolonged neuromuscular blocker use, cerebrovascular accidents, sepsis, and in all of these, or most of these, the underlying mechanism is decreased growth factor signaling. Some clinical significance: the immature receptors are more sensitive to acetylcholine and succinylcholine, so if you are dosing succinylcholine in these patients, you want to give them less. The ion channels stay open 10 times longer than the mature receptors. There is a risk of life-threatening hyperkalemia with succinylcholine use, so again, you want to reduce your dose if you must give succinylcholine. They do have a resistance to non-depolarizing neuromuscular blocking agents as well, and this occurs within 72 hours.